Reducing mortality rate among children less than 5 years by 2/3 this year is Millennium Development Goal number 4. But new districts, especially those categorized as hard to reach, still have challenges ranging from understaffing to availability of priority medicines for mothers and children. The case in point is Bulisa, a new district that was carved out of Masindi in 2006. Authorities here decry the challenge of understaffing for health workers.
45, and yet we probably would have a recommended of about 70%. I think if we are at 70%, we will be operating at a fairly good capacity. So it is low, and there are many factors that contribute to that. As I said, it is hard to reach. We cannot attract and retain. Every time we recruit, we lose them. Every time we recruit, we have challenges of accommodation. As you can see, the environment, the nature of this place.
To streamline the accessibility of health services in Bulisa district, authorities here have asked the health center 2s to perform tasks of health center 3s.
We have a few that at our level here, although not yet operated by the ministry, they are serving as health center 3s because we've already constructed maternity wards there, and we've also sent the requisite staff. We have clinical officers there, we have nursing officers there. And we've written to ministry several times to upgrade this so that at least even the supplies are for that level 3.
Despite this, most mothers here do not deliver in health centers, a factor that puts the lives of both mothers and children at risk.
In fact, we have been called in villages where deaths have occurred, especially in those places that are being operated by traditional birth attendants. The problem, just like I said, the moment they know you are aware, nobody will give you information. And you will reach there and everything will look normal. They will have already taken their body and they will have buried it and you.
To save the lives of children under 5 and mothers, non-government organizations like World Vision have tried to create awareness and provide services like clean water points.
The malaria incidence is low in those areas, and because again we are sensitizing communities about mosquito use, rather mosquito net use. We also see that malaria is not as high in other areas.
Poverty and low male involvement are the major contributors to poor maternal health.
She has talked about maternity dress, a free dress. If she asks, the husband does not buy. So those are the challenges she faces.
But still, in some health units, availability of life-saving commodities and critical medicines for mothers and children remain a challenge.
Bag, it's for resuscitation in case a baby is not breathing well. Then valve syringe sucks the mucus if the baby has aspirated from the mouth and the nose.
Minister of State for Health in charge of general duties, Dr. Chris Monsi, says that there are still challenges in addressing the safety of mothers and children under 5.
Examining our budgets, and we are going to increase the allocations for life-saving commodities, but also working with the national medical stores and the district authorities, improve the arrangements of ensuring that these supplies and other devices can be transported and delivered in the communities as fast as possible. Because sometimes these life-saving commodities have been there, but there are gaps in terms of how the districts and the health facilities requisition for these devices.
Although Uganda has made important strides towards attainment of MDG 4 and 5 that aim at ensuring reduction in maternal and child mortality, there are still challenges along the way. Adiana Kote, UBC News.